I hope I should leave you by 2:10. I will try to cover. I have 52 slides. You don't worry. I will try to just say the content only, but I will try to complete within time. And I wholeheartedly say my thanks to Darshan Sankar sir and his team who has called me, and they have asked us to speak in this very good uh, gathering. See, if you want to say that Siddha could not have a special or a separate vision, because we have a very close relationship and link with, even though we have congruences and differences, we have a very close link with the other Ayush systems, and the what I am going to speak here will be also applicable to the all the Ayush systems. See, we had an earlier vision 2020, and this that great gentleman I have dreamt a lot along with us. But before that, pandemic came into place, and many of his dreams didn't happen. And we will pray to the Almighty that our 2047, the next 25 years, should happen as we dreamt. And more or less, still we have some misses, and we had some hits between some particular areas, but still we have that misses, and we will try to fill the gap. See, when this 2047 came into a talk, every Indian started writing his own vision that how India should be. So it's very very important that dreaming for a better India, and this 2047 should go towards that. So my first dream should be for Siddha or any other Ayush thing should be making Ayush betterly affordable. If you go and see the how we are in the insurance area, or the making health via insurance as happening in other countries, we are little low, and if you compare with the developed countries, see, even though we are listed among developing countries, our role is very low, and if we could reach that within the upcoming 25 years, it will be a very better thing. And how to do that? See, for us, we have universal health coverage, and see, by having an universal health coverage, you can be like a lion, but you can also align with what is happening. That's very very important. And in my upcoming slides, I will try to say some words how we can do that. See, this is very, very important. Now we are using the Human Development Index. When you going to use the Human Development Index, we are not speaking on the lines of the other calculations which the other worlds use. If we are positioned a little higher only if we use the Human Development Index, and my talk will be related to the Ayush portion in that. See, this is very, very important. If you reduce your out of pocket expenses, and if you could do that to a common man, that will be the real social thing which we should do. I will be always saying to my friends, Professor Darshan Shankar sir, even one of our speaker told just before, he will be thinking anything towards how a common man or a stakeholder in between a common man will use. For an example, he has called us. We have a collaboration. Central Council for Research in Siddha has a collaboration with TDU, and he has called us and said that train all the saloon people in and around Bangalore for and train them the basic vermum which they could help at the level of the within the 10 minutes. If a person comes for his making him groom, he is trying to train the beauty salon people, and to make them little more as a stakeholder, and so that they can give a small remedy to a common man. This is the thinking. And if we could reduce the out of pocket expenses, then that is the reality which is going to happen. See, we have been receiving letters from various for the past 2.5 years. I am a trained NABH assessor, and I can say that Ministry of Ayush is very keen to instruct us to get an accreditation for all our hospitals. Now even Quality Council of India has stepped down to say that you go and get your yearly accreditation at least, because they are trying to make it as a habit. What is the use of getting an accreditation? The use of getting an accreditation is that you will be impaneled, and health insurance people will be behind you if you get an NABH accreditation. So if I am there are some guiding principles of universal health coverage, which goes with universality, equity, non-exclusion, and non-discrimination. See what it tried to say to us. It tried to say to us what is available in India as a treatment policy should be available also internationally. We have very few examples. We should expand more. We should cross the boundaries to reach that. I will show one or two examples. This is the this is the guidelines on Varmam therapy practice developed by Central Council for Research in Siddha along with TCM Division, Ministry of Health, Malaysia. Now this guidelines is available with them. With this guideline, they are doing the therapists over there are treating their patients in Varmam techniques. So the same national guidelines we have also released the national guidelines in India, and so it happens. So here I have compared what is happening domestically and what is happening internationally. In the next slide, you can see two publications. One is from our TDU group, that is JIM, and another is from the Journal of Indian Medicine and Homeopathy, the official journal of Government of Tamil Nadu. You can see that both these, if you have a footfall of people coming to the Varmam practice OPD. So the universality of treatment availability is already existing. We should be very much keen to improve that. And if you check into the equity of the cost, you must be knowing that Tamil Nadu was the only state which has 78 COVID care centers at the time of the pandemic was there. See, you can see that the per day treatment in a COVID care center or even with a private person will be less than rupees 200. Whereas you can see that the increasing price, now we can come to an argument and to say that people who need ICU, I am not speaking here about people who need hospitalization. I am speaking about people who didn't need hospitalization or ICU, even their cost was very higher. So it's very clear that Ayush interventions are comparatively cheaper, and we could try to put it in the patient's hand, it will be very easier to reach that point. See, if I could also give an example, this is our publication of what we have treated in an PCL fracture, and this is a fixing up of by a Varmam technique. See, if you go to that, if you go to, sorry. So if you go there, the cost, you can see that it is $387, but this patient was treated in our OPD. So by which I am trying to say that empower all the primary, secondary, tertiary Ayush hospital. If we can do that, definitely it will be a easier process for us to go. See, this is very important. Comprehensive care that is a rational and it is of a good quality. People used to say that when Ayush treatments don't have an randomized control trial. So you can see a randomized control trial, which we have done it integratively with the GAMS Noida, and also we have done it with Dr. Manikavasam is here. He was the person who have been running this clinical trial in Delhi, in which we have compared Nilavembu Kudinir, Kabajura Kudinir and herbal tea along with the standard allopathic care, and we have measured how many times, what is the length of stay of the population in getting treated with this particular intervention, and we have recorded it. So RCTs are definitely possible with Ayush interventions, and so if we could improve our quality, and if we could train our people more, we can definitely reach the goal that we are thinking for. See, this is very, very important. Tamil Nadu is a state in which you have co-location of that is Ayush doctors, either a Siddha doctor or a yoga or a naturopathy doctor or an Ayurvedic physician or homeopathic physician will be available as a co-located person in the primary health center. This is very, very important so that a patient can have their own choices to select the system they want, and it is very much possible. Only this paper very clearly indicates what is happening and what is the utilization behavior of the people who approach the Siddha clinics in Salem. Then see, if I want to say here that an ESI hospital is the last residual place for a common man who is whose income will be less than 20,000 per month. Unluckily, the ESI hospitals are very, very, very minimal for Ayush procedures or Ayush treatments to get continued. So it's our duty that within 2047 we should increase this number. And always we are saying about insurance, but if you want a real, see why I want to put this insurance needs life. I will say you here that we have a very big establishment called as National Institute of Siddha in Chennai, which has not less than, see, after COVID our footfall has reduced. The footfall of National Institute of Siddha is not less than 2,500 per day, which is equated to the Rajiv Gandhi footfall in Chennai. Today it is less due to COVID, it is within 1,800 to 2,000. But it's an NIBH accredited hospital. Still then, the empanelment or reimbursement is not happening there. That is my worry. So it's very important that NIBH has implemented their standards and assessors. We are around 10 assessors availability. We are 10 assessors there, but we have NIBH accredited hospital only 3. So this is very, very important that we should try to increase all our net. We have essential drug list for Siddha, Ayurveda and all. The essential drug list availability itself is one of the point to reach the insurance sector, and many a times our treatments are considered to be rejuvenative than therapeutic. If you go and approach an insurance person, he will say that your things are always of rejuvenative nature. You try to be, as said by sir, that it should be definitely therapeutic in nature, so that we will get more amount of thing. And we have all the digital infrastructure with us. We have, I will proudly say that it's from my institute, the Ayush Hospital Information Management System is happening for the entire nation, and we have our Namaste portal in place. I had respected Ram Manohar sir, who has worked with me in the WHO, the diagnostics course and WHO terminologies. We are coming up with all the global essentialities in Ayush, so it's very, very important for us to do that. And I think only I have 45 minutes more. Sorry, seconds more. So I'll be closing with this, because it will be very good. Increasing number of footfalls per day is a strength for Siddha. But unless or otherwise, if I am going to have my IPD facilities also to be improved well, this footfall will come one day. And establishment of special OPDs like diabetes OPDs, hypertension OPDs, cancer OPDs should happen more. I am the president of Tamil Nadu Palliative Association, but we could establish only 2 palliative care centers. It's very, very more to do that. And if we want to expand our boundaries, we want to expand our scientific presence, and innovations are definitely picking up. And we even have published around 11 patents. And I was speaking with my friend that we should definitely go beyond Dr. Vishwajanani madam and get that how to get away from TKDL and get the patents. So it's very, very important for me. And digital platforms. See, I have a digital tool for recording adverse events of patient. I have a digital tool for recording we have been always cheated by all the other people. They'll be saying that if you are going to take 30 ml of 5 grams of this powder, and one day you will become like Amitabh Bachchan. We will be so all those misleading advertisements can be captured with my tool that I am having, and we have developed. So we have been developing always, and systems like One Health or P4 theory of all health are picking up, but these are all not very new to Ayush, maybe new to allopathy. It's not new to Ayush because One Health is already existing. See, I am coming to this institute from 2004. I can see, and also Balasubramanian sir is working with Vriksha Ayurveda in Chennai. So already we have been in One Health. Now they, as yoga came back to us, One Health is has come to us now. Definitely, if we could, if we could work hard, we can definitely achieve that 2047 thing. Sorry for taking one more minute. Thank you.